And it brings us to another story, this one of Ron Paul. Ron Paul represents libertarianism in America, an ideology gaining steam in this country, as well as an ideology that sees no problem with the two stories that I just told you about. To libertarians, health care is not a basic human right to be provided by our government. Haven't you ever heard of survival of the fittest? Only the strong survive? To Ron Paul and other libertarians, freedom means being free, not having to buy health insurance, and not allowing the government to tax us in order to pay for a basic safety net of health care for all Americans. Here's Ron Paul laying that idea out during one of the Republican debates in 2011.
My advice to him would have a major medical policy, but not before.
But he doesn't have that. He doesn't have it, and he needs intensive care for 6 months. Who pays?
That's what freedom is all about, taking your own risk. This whole idea that you have to prepare and take care of everybody.
But, Congressman, are you saying the society should just let him die?
No.
Yeah, essentially, yes, let him die. Just like Ron Paul did with his own campaign manager from 2008, Kent Snyder. He died. Ron Paul didn't provide health insurance to his campaign staff, so Snyder didn't go to the hospital when he got sick. He got sicker and sicker before being finally diagnosed with pneumonia, but then it was too late. Snyder went to the hospital but died of complications from that pneumonia. Since he didn't have health insurance, he racked up $400,000 in medical bills before he died, which were left to his surviving family to pay. Snyder had helped raise millions for Ron Paul, but in the high-stakes libertarian world, he got sick and died with no one to care for him, and Ron Paul's campaign not paying a penny of his medical bills. How many more stories like this do we need to hear before something changes? Either we make health care a basic human right in America, just like it is elsewhere in the developed world, or we commit ourselves to unrest, desperation, and a sick population. So that's my take. Now let's hear from Austin Petersen, Director of Production at FreedomWorks and editor of the Libertarian Republic. Austin, welcome back.
Thank you for having me, Tom.
So what part of the right to life, out of the Declaration of Independence, life, liberty, and the pursuit of happiness, what part of right to life do libertarians not understand? How can you have life if you are sick and you can't get access to health care?
Well, that's what conservatives say to liberals such as yourself when it comes to abortion. When you talk about a right to life and you're talking about health care, you know, this is a very emotional topic for me personally, Tom, because my mother died from cancer when I was very young, and she suffered and also suffered from a pharmacist who gave her diluted prescription drugs, chemotherapy, diluted her chemotherapy drugs, and she died as a result of this. And now here's the thing. My father and mother worked very hard in order to pay for the health insurance that was necessary in order for them to be able to pay for her cancer treatments. They did this on their own. It was a woman-owned business. My mother owned the business, and my father ran it. And they worked very hard in order to be able to afford the treatment that was necessary so that when my mother did get cancer, she was going to be able to pay for it. We didn't ask the state for a darn thing, and we worked our butts off to make sure that we would have what was necessary so that my mother would be taken care of, because we knew that that would be a possibility. So when it did happen, when that tragedy hit our family, we would be able to afford that health care. So this is not an issue of me not wanting people to get health care or letting people die. This is an issue of me making sure, or my father making sure, and one day when I have my own children, making sure that I will work hard enough to make sure that the people that I care about will be taken care of, because I do care. But what I will not do, what I refuse to do is to go and take a gun and to walk into your house and to take from you to demand that you take care of my mother. I love my mother very much, Tom, but I would never, ever say that it would be morally right for me to steal from you to take care of the people that I love.
Okay, so by saying take a gun and go to my house and steal from me, you're talking about our tax system.
I'm talking about, yes, that's right.
Okay. So you're strongly of the opinion that right to life does not mean the right to health care.
No, that's
that there is no right to health care in the United States.
You're talking about what's the difference between a positive right and a negative right. A negative right is a right that we can exercise that it doesn't impinge on your rights.
That your right
and a positive right would be a health
taxed.
care right, would be something like that you have to go and you have to take something from someone to give to someone. That's the difference between negative rights and positive rights.
My right to say I don't want to be taxed trumps your mother's right to survive another day.
Do you have to be taxed for me to exercise my freedom of speech, Tom?
Well,
there's a difference between positive rights and negative rights. A right is something that must be provided. In order for you to be able to provide something that is a positive right, something that must be provided, force must be introduced into the equation. So what we're saying is, you don't believe that in a utopian society where absolutely everyone could possibly be taken care of in healthcare.
I absolutely do.
No, you really believe in a utopian communist society where absolutely every single person. So then why do they wait 10 months? Why do people have to wait 10 months to get an eye exam in places like Sweden, where my intern goes and he can't even get an eye exam? He has has to wait 10 months.
Because he doesn't have a big problem
So
with his eyes.
So
I
why in
guarantee you, if
Canada,
his eye was
do
bleeding,
they have to wait? Why do they have to wait 3 years to go and get a knee operation in a place like Canada where they have socialized medicine? They're streaming across the border.
You're throwing everything you can at the wall, and it's not sticking.
Because you're trying to make this an emotional subject.
No,
and I can do the exact same
rights.
thing. Yes,
it's
positive
about
rights.
Is there a right
rights.
to health care?
And you claim that there is a positive right.
Every developed country in the world says yes.
So you own my body. You own a part of my body, my time, and my labor, and you own health care, the doctor's time.
Your logic is bizarre.
No, really? You think the doctors go and pay hundreds of thousands of dollars and work their butts off to go and get those medical degrees, and that they don't have a right to profit off of that? Don't you understand that how the profit motive works? That if they were going to make more money, they would have more patients. That's how capitalism works, Tom. By helping each other. I don't make more money by screwing you.
Austin, stop the filibuster machine here. I'm not suggesting that we don't pay doctors.
You're suggesting that libertarians don't care about people, Tom, and you're wrong.
Yeah, oh, come on, Austin.
Yeah, you're suggesting that we're heartless.
This faux outrage is absurd.
This is not faux outrage. You brought up this thing with Kent Snyder and Ron Paul.
Okay, if you want to get upset about this, let me say Ron Paul killed his employee.
People are dying out there.
And your mother was killed by a country that didn't provide her with health care.
She was killed by a pharmacist who didn't give a damn about her. If she was killed by a cancer,
and you're trying to tell me,
nothing to do with government intervention.
What you want to do is you want to tell every American out there that if you don't have a job, and in fact, you want to tell yourself, Austin, this is the really sad part. You want to tell yourself that if you don't have a job and therefore you don't have access to health care, you don't have the money to pay for it, then you're dead.
It's not about having a job, Tom. It's about lowering costs. And you don't even necessarily have to have a job to pay for certain procedures.
Lowering costs is not a right.
What do you mean?
Life is a right.
Where am I right now?
Life is a right.
Okay, so then no abortion, right? So you're against abortion?
This has nothing to do with when life begins. That's a whole separate debate.
So then babies, all the 50 million babies that have been killed since abortion has begun.
Again, you keep trying to change the subject.
A right to life, Tom. You sound like a pro-lifer.
The right to life was originally for people who were opposed to death penalty.
But not unborn children.
This is not about that. This is... If somebody is pregnant, they should have access to medical care.
Okay.
And I am perfectly willing to pay taxes for it, and you should be too.
But, okay.
You are a
so
piker.
You're willing to do it, but
trying to weasel out of being part of society. Right. That's what libertarians are doing.
And you're willing to use force to force me to do what you think is right.
Absolutely.
Well, I think
absolutely. I will own up to it. Absolutely. The tax.
And we should invade China. We should invade Russia. We should invade Pakistan because I think that's right, and I think you should pay for it.
This is pathetic.
And every civilian
if you don't want to pay taxes, you are a piker. If you don't want to pay your fair share of the cost of society, you're just trying to weasel out of it.
I can just make up anything that we want that's a right. What else can we do? I have a right to gourmet food, right? I have a right to a steak.
I don't recall gourmet food in the Declaration of Independence.
Well, I don't recall health care in the Declaration of Independence.
Life is in the Declaration of Independence. How do you have life if you're sick and you can't get treatment?
Well, you know
how do you have it?
Well, you've got to fight for yourself.
Where do you go get it? You got to go fight it for yourself.
You got to go.
So we have the right to stand outside the hospital and beg.
But do you have a right to die?
What about this guy who was sick?
Tom? Do you have a right to die?
Absolutely, and I'm in favor of Oregon. But again, you're changing the subject.
No, we're talking about rights, Tom. What is a right? A right is something that must be provided, right?
Absolutely.
Must be provided,
absolutely.
Right? So a positive right versus a negative right.
This is a right is something that it is the obligation of society to provide.
Oh, really? Society?
Yes.
Who is society? Well, you're confusing government with
society,
on this. Tom.
Government was created by us.
You're forgetting everything that I've taught you.
Government was created by us.
How many times?
Society, our government is us.
How many times do
I understand libertarians hate America. I understand.
No, we love America, Tom. We founded this country.
Libertarians hate the idea of America. No, America was founded America was founded by guys who said, for the general welfare, we're going to do this together. The first president to sign legislation to provide for health care for poor people in America was George Washington.
No. Well, then why didn't they start the income tax? If the founding fathers were all thinking about Americans, then the general
because they were paying for it with an absolutely brilliant tax on imported goods.
Why no health
tariffs? But that's a whole different topic. Again, I'm just astounded that libertarian. I mean, I just find it tragic. I'm saying this to you
too, Tom,
as a human being.
I think we want the same things.
No, I'm not. This is not talking points, Austin.
Tom.
I find it tragic.
I've got no talking points.
Okay, how are you going to care for people who can't get a job and are sick? What are you going to do?
Well, I will personally help them, Tom. I donate all the time to causes that I find to be
So you
good
want us to put your
causes.
phone number up on the screen, and if somebody's sick, they should call you?
You can go to austinpetersen.com, go to the libertarianrepublic.com. Anyone who needs help, I will be glad to help people as much as I can within my own
That's
purview,
your
Tom.
solution.
That's right, but what I will not do is I will not take a gun and come into your house and demand that you do the same.
Or empower the IRS to do the same.
That's correct.
Austin Petersen, thanks for being with us.
Thank you, Tom.
I think we've figured out where we both stand. Coming up.